I'm a registered respiratory therapist at the University of Virginia Medical Center in Charlottesville, Virginia. I'm also president of the International Council for Respiratory Care, where we are striving to advance the safe, effective, and ethical practice of respiratory care worldwide. We consist of over 32 member countries as of today. How I became an RT was fortuitous, but it stemmed off of a high school program that I completed my senior year, which was titled Healthcare Occupations. And I was selected among a group of high school students within the district in a suburb of Seattle that went through a healthcare occupation program that exposed aspiring senior high school students who wanted to go into healthcare to get observations of different healthcare disciplines. And then eventually I ended up in a respiratory therapy training program. Having also been exposed to it in high school, I was already somewhat familiar with the curriculum and the clinical practice. I'm the respiratory therapy adult clinical coordinator here at University of Virginia, which means that I'm a clinical specialist. I get many consults from our medical teams in critical care to see some of our sickest patients who the bedside staff may need some consultation and expert opinions on in terms of how to manage patients on mechanical ventilation. I'm also our department educator, which means that I do new employee orientation. I keep up to date with healthcare literature so that I can introduce evidence-based practice into our standards of care. And I also provide presentations and labs to disciplines outside of respiratory therapy. And then in addition to that, I'm our researcher for my department as well. What interested me in going abroad with respiratory care was that I was invited to participate in a medical mission in Haiti back in 2010 after the devastating magnitude 7 earthquake that hit the country. And the School of Nursing here at the University of Virginia had some nurses who were going down, and they wanted a respiratory therapist, knowing that we have specialized knowledge and skills that would be beneficial. And I volunteered to go to Haiti. And because of that experience being so enriching and life-changing for me, I continued my pursuit of reaching out internationally because I saw that my specialized knowledge and skills have definitely influenced what I was providing in Haiti. And I recognized respiratory care was a fairly new profession in many countries abroad. So therefore, as I started reaching out with my involvement with the American Association for Respiratory Care's International Committee, I started developing networks. And as a result of that, the next thing came, and that's through the International Council for Respiratory Care involvement. And that includes, as I said earlier, about 32 member countries where we have leading opinion leaders from around the world in respiratory care who get together and have an annual meeting. But during that time, outside of the meetings, we actively contribute to policy and procedure development, sharing resources for respiratory care expansion and improvement of respiratory care in other countries. So when I was in Haiti, my day-to-day activities were very busy. They don't have respiratory therapists there. It was fairly new to the physician and licensed independent practitioner staff, having multiple teams from different countries providing care to their patients. So my day-to-day operation was to place myself in situations where we were seeing acutely ill patients in the emergency room and providing not only thorough pulmonary assessments on them, but life-saving interventions. I was also placed in the TB clinics. There was a TB outbreak when we were there. So I was assessing patients, ensuring that they had supplemental oxygen, but also recognizing some of them may have had other needs that we were not able to provide them with because of resources being limited. So I had to be able to strategize what we were able to offer within the context of their culture as well as availability. I've spent also quite a bit of time in Asian countries, specifically China. And when I'm in China, I don't provide necessarily clinical practice, but I do daily rounds with the medical staff. And in many hospitals, respiratory therapy departments are proliferating and have been proliferating over the last decade. So as a result, I provide a lot of just-in-time lectures, speaking at conferences, and then networking with hospital presidents and directors of critical care units as respiratory therapy expands in those countries. I think it's been very fruitful for me to be a respiratory therapist because I don't know what my day is going to look like until I get here. I see a diverse patient population with what I do in emergency and critical care. I'm not sitting behind a desk all day, which is very nice. So I like the activity of being able to go all over the hospital to provide respiratory care services to a plethora of patients from infants to pediatrics to adults, as my department colleagues do. And also, if you don't want to work in a critical care environment, you can work in areas such as pulmonary function and sleep disorder centers doing diagnostic imaging. You can be a healthcare educator, and you can work in home healthcare. So there's many opportunities where you can use your specialized knowledge and skills to really be that frontline healthcare provider, providing education, but also having a direct, immediate impact on patients from the time they enter the door of a hospital until they leave, or you can actually train the next future healthcare generation respiratory therapists to become these superlative healthcare providers. Having worked abroad and being involved with respiratory care definitely has impacted my career and in a very favorable way. My first trip to Haiti, I was placed in situations where we had limited resources. So I had to utilize my critical thinking, but also my clinical experience to be able to provide care within the confines of what I had available to me at that time. I also had to work with teams where English was not necessarily even a second language for them, but we were able to communicate because we all have baseline knowledges and skills with a vision to help patients. So working collaboratively in teams was very important. And then I find the same when I'm going into Asian countries and dealing with other healthcare providers around the world. I've just recognized that we all share a very similar, if not the same vision, and that's to provide safe, effective, and ethical practice of respiratory care worldwide. When I'm back here in the United States, I've recognized that we have access to resources that very few countries do. And for that, I'm grateful, but also when I'm traveling abroad, I do have to keep that in mind, recognizing when I'm providing presentations or education, what's practical for that setting. The thing that I most enjoy about international respiratory care is helping people share the passion that I have towards improving patient respiratory care function and helping them understand that we are all in this together. And by sharing these resources that we have, some have more resources than others, we can find this leverage so that we can start standardizing care and also sharing our passion towards improving the care of those we actually take care of. So when I start thinking about similarities and differences between working in the United States and out, of course, it comes down to resources, but also recognizing that respiratory care is still an evolving profession in many countries. So they have maybe respiratory therapy departments with 10 or less respiratory therapists within a 500 or 600 bed hospital. So their resources and such are very limited in terms of staffing. So there's a lot of cross training that has to occur there. When I go to other hospitals, may have a respiratory therapy department with 30 or 40 respiratory therapists, and they work specifically in an acute care setting and not in diagnostics. When I think about our work here in the United States, where we're the gold standard of respiratory care here in North America, our roles are completely different because they've expanded outward from acute care facilities into diagnostics, like I said earlier, pulmonary function, sleep disorders, and then into home health care. And now we're branching into disease management with case management workloads. So my last words of advice for anybody thinking about going into respiratory therapy, again, is do your homework, learn about the profession, and then when you enter into the program, work hard because you have patient lives in your hand every day, and you are one of the first people a patient in distress will see in a hospital. Take pride in what you do, and then eventually share that pride, not only every day within your colleagues, but then within your communities, and then further outward. And then find a mentor, and continue pursuit of lifelong learning.